we begin with President Biden testing positive for COVID-19. The president posted a short video on Twitter earlier today saying he's doing well.
Hey folks, guess you heard this morning I tested positive for COVID. But I've been double vaccinated, double boosted, symptoms are mild, and I really appreciate your inquiries and your concerns. But I'm doing well, I'm getting a lot of work done, I'm going to continue to get it done, and in the meantime, thanks for your concern, and keep the faith, it's going to be okay.
Under the heading of mild symptoms, the White House says they include a runny nose and dry cough. The 79-year-old Mr. Biden is taking the antiviral drug Paxlovid. The president received 2 doses of Pfizer's coronavirus vaccine shortly before taking office, a first booster shot in September of that year, and an additional booster dose on March 30th of this year. First Lady Jill Biden says she has tested negative. At today's White House press briefing, Press Secretary Karine Jean-Pierre said the president will continue to work in isolation, again, until he tests negative. And COVID-19 response coordinator Dr. Ashish Jha, who was also there, said the president's vaccination status means his risk of serious illness was, quote unquote, dramatically lower.
In terms of my conversation with the president, he sounded great. I asked him, Mr. President, how are you feeling? He said, I'm feeling fine. He said he was feeling fine. He had been working all morning. He hadn't even been able to finish his breakfast because he had just been busy. I encouraged him to finish his breakfast.
He has mild symptoms. He continues to work, and like many Americans, this is we have to make sure that we send out message to make sure to get vaccinated and boosted if you haven't yet.
For more on this, Tolu Olorunipa joins me now. He is the White House bureau chief for the Washington Post, and I believe the newly minted White House bureau chief for the Washington Post. So many congratulations on that. Tolu, busy day at the White House today. So briefly, how is the president doing, and how is the White House explaining how he will do the work of president while in isolation?
Yeah, Major, you mentioned mild symptoms. That's the way the White House is describing it. We saw the president on that video. So that's the evidence that we have of how he's doing. Now, obviously, as reporters in the White House press briefing room, we're going to be asking as many questions as possible to try to get as much information and transparency as possible, because there has been a history in this country of presidents not always being forthright and forthcoming with the public about their health. Now, President Biden is 79 years old. He is at a higher risk of serious concerns from the COVID-19, but he also has a number of things going in his favor. He's got the the vaccination, the boost, the double boost, as well as a number of therapeutics that he's going to be treated with, and the best healthcare in the world. So according to the White House, he's doing fine. But in our profession, we're going to be watching very closely, seeing if there's more information that comes out, seeing if we can hear from the doctor that's treating him directly beyond just a statement, and maybe having Kevin O'Connor, that doctor, come out and answer questions about some of those mild symptoms and whether those symptoms get worse or whether they get more intense over time.
And Tolu, as you mentioned, that was a bit of friction at the briefing today because, as you just said, Dr. Kevin O'Connor, the president's personal physician, who is the one who actually saw the president, took stock of him today, wasn't at that briefing. And if you're going to talk about transparency, it seems reasonable to assume that the most transparent way to do that would be have the treating physician at the podium answering questions.
Yeah, I was in the White House press corps at the same time when Donald Trump, the former president, was contracted COVID-19 and was taken to Walter Reed. And during that period of time, we did hear from the doctor that was treating him. Now, there were a number of questions about transparency and spin and some of the information that was put out by that doctor, but reporters did have an opportunity to ask him some questions, and even the way he answered the questions or dodged those questions was telling in its own right. So I would expect and hope that we get even more transparency from this White House about how the president is doing. He is an elderly person, and this has been one of the top things on his agenda, sort of showing the country how to deal with the coronavirus and showing the country how to live with it. And now that he has not only the vaccine, but also the therapeutics that he could be using, it's an opportunity for this White House to show as much transparency as possible and allow the American people to know that this is something that we don't have to allow to take over our lives, that there's a way to live with COVID-19. There's a way to not have it be as tragic as it has been in the past.
And Tolu, it's my impression that among the things the White House press corps has been trying to learn from this White House is how frequently is the president tested? And what is the approach to the frequency of that testing? We know his most recent negative test was Tuesday of this week. Then, lo and behold, he tests positive this morning. Do you expect the White House to be a little bit more candid about that going forward?
They will continue to get questions about that because that's something that everyone is interested in knowing. Sort of, what is the testing protocol? How do we know that the leader of the free world is being kept as safe as possible, and the people that are coming close to him, the people that he's having close contact with, are also being tested? So that is something that I imagine there will be more questions about because it is key to showing that the White House, that has unlimited resources, the best health care in the world, can keep the president safe, can keep the president healthy. And we've heard that obviously this virus and this most recent variant is incredibly contagious. And so it's likely that a number of people are going to test positive. But it's important to know that the resources being put forward by the White House are being used in the best way possible to keep the president safe and to keep the country safe as well.
And Tolu, you made reference to President Trump contracting coronavirus. Today at the briefing, Karine Jean-Pierre said, we knew this would happen. Of course, we all remember back when President Trump contracted COVID, the idea was it really couldn't happen, but it happened nevertheless. And we learned much later how sick President Trump actually was. Take us back to that time and how you compare and contrast that era with this era.
Yeah, this was just a month before the election, so there was a lot at stake. There was a lot riding on the president's health. The president wanted to be out doing rallies, and there was a lot of reasons why the president's aides and the people close to him would downplay how serious the concern was. But reporters kept asking questions. We were trying to put two and two together. Things were not making sense. And it became clear pretty quickly after a lot of those press conferences were not making sense that he was more sick than we understood. And when he was whisked away to Walter Reed, it wasn't clear that he was going to make it out. It wasn't clear that he was going to be okay. Now, he obviously had access to the best healthcare in the world, therapeutic and emergency treatments that he was able to use, and he was able to come out of that okay. But it was a very hairy situation. It was a very dangerous situation for the president, who at the time had not been taking COVID very seriously, had been holding a number of large gatherings without masks, without social distancing at a time when there were no vaccines, there were very few therapeutics, and he was a wanton about the way he dealt with COVID, and he did contract that virus. And so it was clear that the White House was not forthright as possible when they wanted to show exactly what was happening. So journalists had to find out what was happening behind the scenes. And it was a very, very scary situation for the leader of the free world.
Journalists had to find out. The Washington Post's new White House bureau chief, Tolu Olorunnipa. Thanks so much.
Thanks, Major.